Is the IUD an appropriate form of hormone replacement therapy, especially as you get over the age of 40 and into perimenopause? Have you considered, or do you have an IUD and you're over the age of 40 and you have a lot of questions? Specifically, the IUD known as a Progestin IUD, which is commonly called Mirena, a Skyla, a Liletta, or a Kylena, then this is the video for you. Hi, my name is Dr. Carrie Jones. I am a women's health and hormone expert, and you want to hit that subscribe button because I know hormones can feel like herding cats, and I am here to help. First of all, there are two types of IUD, so I want to make sure that you understand because we're going to focus on the progestin kind. There is a copper IUD. The copper IUD does not have any hormone in it. It is commonly called the Paragard. It is completely for birth control purposes only. The progestin IUD has levonorgestrel in it, which is a progestin, which is a synthetic progesterone. We will get into progesterone later. So if you have questions about, can I take progesterone with my IUD? Possibly, and we're going to talk about that. But this IUD doesn't have progesterone in it. It is a progestin. It is the synthetic levonorgestrel. The kinds are Mirena. That's probably the most common. It is the one with the biggest dose. It's the one that lasts the longest. Then you have maybe heard of Skyla or Liletta or Kylena. These are all the names of the other IUDs. So once an IUD is inserted, it is used multiple ways. You may use it for true birth control purposes. It's great. It's a set it and forget it. A lot of women love it because depending which one you have and the dose of progestin, you may last 3 years all the way up to 8-10 years. It sort of depends on which one you've chosen, you, your doctor, etc. So again, like I said, set it and forget it. Now, it's important to know when I say for birth control purposes, just because you're over 40 doesn't mean you can't get pregnant. Women in perimenopause who are still having cycles, still ovulating, releasing that egg, can still get pregnant. The numbers aren't as great, meaning like your percent chance isn't as great as when you were a lot younger, but it's definitely not impossible. And lots of women get pregnant in their 40s. So please don't be confused that just because you're over 40 doesn't mean you can't get pregnant anymore. So this is the very common reason that women will use a progestin IUD. Number two, the IUD is often used when there is a lot of heavy bleeding and a lot of cramping. And maybe you've put them together. Maybe you just have cramps or maybe you just have heavy bleeding. And heavy bleeding, unfortunately, is a common symptom that can happen to women as they get over 40 and into perimenopause. That shift in hormones where progesterone production goes down, progesterone being the soothing, calming, relaxing hormone that we have in the body, plays a huge role in the uterus, and it can help us have nice, easy periods. So if we don't have as much progesterone anymore, then sometimes maybe your doctor, your OBGYN says, maybe we should try an IUD because the progestin in the IUD thins out the lining, the inner lining of your uterus, so it's not so thick and gloopy, and that way your period won't be heavy and thick and clotty and gloopy as well. So heavy periods and then also cramps are a big reason for the IUD. Now, another reason that an IUD, the progestin IUD, is suggested is to reduce the risk or to combat what's called hyperplasia. Hyperplasia is when the inside of the uterus, known as the endometrium, gets thick, and it can get thick from a lot of estrogen, specifically estradiol. When a lot of estradiol is floating around kind of unopposed or with not enough progesterone to counterbalance it, then that inner layer, that endometrial layer, gets thicker and thicker and thicker, and it's called hyperplasia. Now, the thicker can lead to really heavy periods, can lead to a lot of clots. Worst case scenario, though, it can also lead to uterine cancer, which we don't want that. So if you are on estrogen and you have your uterus, it's possible an IUD, a progestin IUD, was suggested to you is the counterbalance to that estrogen hormone replacement. It's also possible you've been diagnosed with hyperplasia, uterine hyperplasia, and your doctor, your OBGYN said, hey, we're going to insert the progestin IUD to reel that back, thin that out so you don't have that thickness anymore. That's another really common reason for the IUD. Now, when it comes to this progestin, one of the things I often get asked about is breast cancer. Is there a risk for breast cancer? Because it is that progestin, it is that synthetic progesterone that is in the IUD. Now, according to an organization known as ACOG, which are for obstetricians and gynecologists. They said in 2018 that, and I'm going to read this directly, the relationship between progestin-only contraceptives, such as an IUD, and breast cancer risk warrants further study. Essentially, it's not zero. There are some studies to show it's sort of like maybe it's kind of depends on dose, but the IUD is only in for 3 to 5 to 8 years, sort of depending on the person. It's not absolute, but you should know the risk is not zero, which unfortunately is unfortunate. And I think that should be well known. There are a lot of benefits to the progestin IUD. This is potentially, of course, one of the cons. Now, let's talk about side effects to this particular IUD. For better or for worse, because it thins out the layer of the uterus, a lot of women don't get their period anymore, or they get very light spotting. It doesn't mean their ovaries don't work, but it does mean that they maybe don't bleed. So this can be sometimes hard in determining, am I still cycling? Am I close to being menopausal? Where am I in the perimenopausal journey? Because I don't have any way to let me know that my periods are regular, irregular, skipping, because I just don't get a period anymore. Now, that can also be a really nice thing. A lot of women are like, whoop, I love it. I haven't bled in years or months, and it makes me so happy. It makes planning so much easier. It makes travel so much easier. So pro-con when it comes to that. Now, some other common side effects that I do hear with the progestin IUD, because it is a progestin, that I have absolutely had women said, I have a lot of GI symptoms related. I have some back pain. I've got greasy hair, greasy skin, change in headaches, worsening headaches. So I definitely have seen that the progestin, even though it is inserted up into the uterus, because it can go systemic, which means it can go out to the whole body, that if you get an IUD inserted and you start to notice some crazy weird hormonal symptoms or body symptoms, put two and two together, it might be due to the progestin IUD. Here's some interesting, just anecdotal experiences I've had with all my patients through the many, many years with the IUD. Women either love it or hate it, the progestin IUD. I don't seem to find a lot of gray area women. The women who love it, get it inserted, have no issues, have no side effects. They sail through their many, many years, and then eventually they get it out, changed, and get their new one, and everything is good as gold. The women who hate it usually get it inserted, and they get symptoms right away, or oddly enough, they get symptoms after a couple of years. I don't know what the mechanism of action is of this. I have asked other colleagues of mine, I've asked my OBGYN friends, do you notice that the women who hate it tended to get symptoms either right away or after a couple of years? It's kind of this weird, and then they're like, yeah, actually I have. So if you have an progestin IUD and you've noticed like all of a sudden you're getting all these weird kind of hormone symptoms or headaches or acne or greasy hair or back pain or mood changes where you're like, what in the heck? Yes, I realize this could be perimenopause, and be aware anecdotally, it could be related to the progestin IUD. It's much, 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 much more common in the Mirena than it is in the others because of the dosing. The Mirena has the higher dose of progestin compared to the others. Now, I brought up progesterone. Is progesterone the same? And it is not the same. And this is a common question I get because women will read and see on social media all about progesterone, the bioidentical, like what's in their body, or bioidentical creams, or bioidentical Prometrium, which is the capsule you can get at your local pharmacy that will help replace the progesterone that's lost. And they'll say, is the IUD, this progestin IUD, the same thing? It is not the same thing. Now, here's what's interesting. When the progestin IUD is inserted, you will hear people go, oh, it's just local. It only stays in the uterus. But we know that's not true because there's no way to make it stay local. There's no gate, there's no fence, there's no nothing. Like when it's inserted, progestin absolutely acts locally right there in the uterus, but then it gets in the bloodstream and goes all over the body. So when you read the actual paper, the white paper that the all pharmaceutical medications have to have a white paper associated that says the ins and outs. When you read the FDA white paper on the Mirena as an example, they say in there that after a year of use, they found that 65% of women don't ovulate. So that progestin goes up to the brain and says, hey, brain, don't release an egg. So great for fertility, well, preventing fertility, I should say, but great for birth control. But when you don't release an egg and you don't ovulate, you don't make your own progesterone. After 4 years, 25% of women don't ovulate, so they don't make their own progesterone, which means over time, some women get their ovulation back and they totally do make their own progesterone, but not everyone. So 65% down to 25%. But still, if you're in that 25%, that means you're missing out on progesterone. Leads me to the question that I sort of posed in the beginning. Can you do progesterone and a progestin IUD? And the answer is yes, if you are a candidate. So I absolutely had women, when I saw patients who had a progestin IUD for either heavy periods or for true birth control purposes, but they weren't sleeping. They had a lot of anxiety. They were having all the other systemic low progesterone symptoms. And so we added in progesterone. We added in progesterone capsules, such as in the form of Prometrium, which is the pharmaceutical brand, or compounded, depending on the person. And so that it is an option that you can talk to your healthcare practitioner about. If you love your IUD, but you are noticing now that you're over 40, you're not really sleeping, and you're feeling more anxious and kind of irritated and, overwhelmed and thinking like, wow, that progesterone, that calming, soothing progesterone action would be really nice right now. Talk to your practitioner about even layering in a progesterone capsule, such as Prometrium, to add to your whole progesterone picture. Now, here's where the other thing is interesting. If you get your IUD out, can you then also add in progesterone? And the answer to that is yes. And I get this a lot where women say, I'm going to have the IUD out. I'm over it. I'm done with it. I want to stick with just progesterone, or I want to be bioidentical. Can I move over? And the answer is yes. However, I will say progesterone by itself, like as a capsule, for example, may not be strong enough or what you're used to, depending for the reason you had the IUD. So for example, if you had pretty significant cramps and you had the progestin IUD to reduce your cramps, the progesterone may not be enough to get the cramps down the way the progestin IUD was. Or if you had really super heavy gush-worthy periods, well, the IUD is really strong and it really thins out the layer and it really reduces blood flow. Progesterone, like Prometrium, helps, very helpful, but not nearly as strong as the IUD. So you do want to talk about all these pros and cons with your doctor between the IUD and progesterone. Should you layer them? If you remove the IUD, what's the reasoning that you had it in the first place? What can you do to help mitigate any of the symptoms that potentially may show up again, having the IUD out? Now, I will say I am in the camp that if you never had an IUD in, so some women will say, I'm 45 or 48 or 50, and I don't want to do birth control. I don't need it for birth control, but I'm looking for hormone replacement. I personally don't start with an IUD. That's just my personal opinion. That's not my go-to. My go-to is to start truly with progesterone, like the kind you make in your body. And then, of course, estrogen, if that's what they need and where they're at and if they're a candidate. So I put those two together. I don't start with an IUD. But if you're listening to this and you have an IUD, or you're listening to this and your OBGYN is suggesting an IUD for pain or for super heavy periods or truly for birth control, then I want you to have all the ins and outs, all the pros and cons, and know how we use it, and then can you use it with progesterone at the same time? Last question, let's pretend you do have a progestin IUD and you're ready for estrogen. You're like, I use it for birth control, the IUD, or I use it because my periods are so freaking heavy, it made me anemic, and this was the one thing that stopped it. Like, I really need this progestin IUD, and I've progressed enough through perimenopause, I'm ready for estrogen. Can I do both? Can I have an IUD and do estrogen? As long as you're a candidate for estrogen, the answer is yes. You can layer estrogen, like an estrogen patch, for example. You can do the estrogen patch, commonly used in perimenopause and menopause, with an IUD. The IUD is protective against, again, that thickening, that hyperplasia. So the answer is yes, you can layer those two. Hopefully this video answered sort of all your IUD questions, IUD with progesterone, IUD with estrogen, because there's a lot of interesting sort of myths and misconceptions out there around the IUD, when we would use it, what happens if you're over 40, can you still get pregnant, what is hyperplasia, and I understand. Hormones feel like herding cats, and I am here to help. So hit that subscribe button, Like this video, ask any questions below, and I will continue with answering your questions.